Hi there, Dr. Tansavatdi here. So this video today is the consent process for your upcoming brow lift surgery. In addition to this video, there is another video on the post-operative instructions for your brow lift surgery. I do encourage you to watch both videos before your upcoming pre-operative appointment so that you're prepared for your appointment and we can breeze through the appointment together. All right, so any informed consent always starts off with the potential benefits of surgery, the risks that are associated with surgery, and also the alternatives to the brow lift surgery itself. So I'm going to highlight first what are the benefits of brow lift surgery. So brow lift surgery addresses the position of the brows to elevate them to address any heaviness of the brows, as well as what we call hooding from the upper eyelid heaviness. So the upper eyelids themselves can be addressed with an upper eyelid surgery, but if the brows are a big component of the heaviness of the upper eyelids, it's most important to lift the brows as well. And so that's why you're listening to this consent process itself. The other thing that a brow lift surgery will address is the forehead lines or wrinkles. It will soften the forehead lines, but it will not diminish them completely. That would be done with other procedures such as a CO2 laser or a chemical peel. So the forehead lines will be diminished but not gone. And that's because the forehead muscles are not cut when we do this procedure. They are left intact. The forehead muscles are the only muscles that raise your brows. And so we want them to be intact, because after surgery, if those muscles do not move, your brows will descend with time. And we don't want to reverse what we've done so well. The other muscle, though, that is cut during surgery, and this is in the case of most of the procedures, but not all, where the frown muscles are cut to address the frown lines. And so the muscles will be more weak, and you will be able to move them, but not as strong as you once did. So the frown lines will often be diminished considerably from this procedure. There are brow lift procedures that don't address the frown lines, and so I want to point them out. Depending on what surgery we decide is best for you, we may be doing a direct brow lift, which only addresses the position of the brows and the heaviness of the upper eyelids, and the incision is placed just right directly over the brows themselves. There is a mid-forehead brow lift where the incision is placed in a forehead wrinkle, and that we do mostly in men who have deep lines and cannot hide the incision necessarily in the hairs. So that's a mid-forehead that does not necessarily address the frown lines too. It depends. The other procedure we might do is a pre-tracheal, which is right within the hairline. And that's done to lower the hairline if you do have a high receding hairline. The other procedure is an endoscopic brow lift, and that's the majority of the cases I do. That's about 50% of the cases. The incisions are hidden in the hairline so that you're not able to see them. With that procedure, we do lift the brows and we do address the frown muscles at the same time. There's also a temporal brow lift. That means the incision is placed on the outside here, and we're only lifting the outside of your brows. That will not address the frown lines themselves. So there you have it about the different brow lift techniques, and the technique we choose is going to be the one that we think is best for you, depending on what you're trying to achieve with the outcome. All right, alternatives to brow lift surgery. So what are other options that you have? You don't necessarily have to go with surgery. There are risks with surgery. So what are some other options that you have? Botox is a good alternative, but it does need maintenance, and it can't quite lift the brows as heavily as you can get with brow lift surgery. So you can get maybe a millimeter or so by injecting a little bit of Botox around the eyes to soften the muscles that are tightening and lowering the brows. If we do any Botox to the forehead, it will soften the forehead wrinkles, but it will not allow your brows to elevate per se. The other option that you have is what's called a thread lift. A thread lift can be placed, it's just like its name, you're placing a thread that is supposed to dissolve over time, and that has to be repeated. So you can get a good lift with it, but it will be repeated once a year just to maintain what you're getting. The last alternative is doing a CO2 laser or chemical peel to soften the forehead lines, but it does nothing to necessarily give you quite a lift. It will just soften the forehead lines. All right, so those are the alternatives to brow lift surgery. What are the inherent risks of brow lift surgery? There are some risks associated with the brow lift surgery itself, and then there's general risks. General risks would mean that it's true for any type of surgery, and that would be things like infection, bleeding, scarring. So I'll highlight the risks associated with brow lift surgery first. The first on your sheet, if you're looking at this while we're reviewing this, is bleeding. Bleeding is uncommon, but it can happen under the flap or the skin when we've raised it. And that collection of blood, if it expands, creates what we call a hematoma. And a hematoma is a collection of blood that, if it continues to expand, can create pressure on the eye, and it has to be drained. Otherwise, it can lead to complications. So that is something that can happen after surgery. The biggest reasons that it could happen are because if you're on a blood thinner, or you raise your blood pressure after surgery from, bearing down or having some increased pain. The things that help after the surgery is, particularly with endoscopic brow lift surgery, I will place a gauze and pressure dressing over the forehead itself, and that comes off on day 1. So you'll come the next day to have that dressing removed. In addition, if we are doing a pre-trip reel or a temporal brow lift, we'll also most likely be using that compression dressing. Second is infection. Infection is uncommon with this type of surgery. There's good blood supply to the face and neck, so we rarely see infection. You're going to be on a prophylactic antibiotic going into surgery, so that minimizes the risk as well. But the risk of infection is low, so I don't want you to worry too much about it. You can have localized infection along the incision. Those are uncommon but can happen, and usually an antibiotic ointment will address that. And that's usually all that is concerned in these areas. Change in skin sensation. This is something where there is a nerve that is a big nerve that we work around during the surgery and we preserve, and that is the supraorbital nerve. There's also a supratrochlear nerve, and both these nerves give the nerve supply to the top of the forehead and this central portion of your forehead. So that is preserved, but you may have some numbness after surgery that may last a few weeks to a few months. And it's typical after this surgery, and it typically returns. If you do have any area that might not return, it can take up to a year to fully come back, but some people may describe like a little spot at the very top of their head that might not completely come back. Again, not a big deal, but it is something you need to know about. Skin contour irregularities. That is where you can have dimpling in the scalp itself from the incision, or from when we do a temporal brow lift or a endoscopic brow lift. I do place a suture deep underneath the flap here and secure it to the muscle over here, and so there's not an implant per se in that area. For an endoscopic implant, the endoscopic surgery, I do put an implant that's dissolvable, and you might feel some contour right there, right underneath the scalp in your hairline from that implant. But on the sides, when we do the brow lift for this outside portion of your brow, there is a suture that's placed deep because you can't really put an implant in that location. So that suture is deep, but creates a little dimpling. That dimpling goes away, and it takes about 4 to 6 weeks to completely go away. So be patient about that, and that is all that you'll really notice with the contour irregularities. These are temporary, and they do go away. Next is scarring. Anytime we make a cut on any part of the body, the cut does leave a scar. With time, that scar heals and matures and does not bother most people. If the scar is something that it becomes more visible, then we may address it with revising the scar. I've never had to revise a scar for any brow lift surgery, so That being said, I just want to point that out to you. It's uncommon to have to address the scars because they heal so well in the area that we've placed them. Change in approach for your brow lift. We may change the approach. So I've said already the different techniques for brow lift surgery. If we need to change the technique, it's uncommon because we've already made the decision about what's the best technique for you. However, I have had to change in one instance in my whole career, and that has to do with changing an endoscopic approach to a more open approach because the bone didn't accept the implant very well. Again, that's uncommon, and we would let you know ahead of time if there's any potential for that. But most of the time, the approach, we stick with the approach that we've chosen. Surgical anesthesia. That it has to do with there's complications with general anesthesia, and there's also risk with any injection of local anesthetic. That would be the lidocaine or the Narcan, not Narcan, so the injection that we're doing to numb the flap or to numb the skin, the area that we're doing the procedure. So that itself, we're not using a large amount of local anesthetic, so the risk there is low. With general anesthesia, the anesthesiologist will go over those risks with you at the time of surgery or the day of the surgery. Next on the list is nerve injury. Nerve injury is rare. Again, the two nerves for sensation that we preserve and we work around is the supratrochlear and the supraorbital. Those two nerves are preserved but can lend to a little bit of numbness after surgery because we're working around them. The other nerve that's important for you to know is the frontal branch of the facial nerve, which is a motor branch. It allows you to lift your brows. And in doing so, it preserves that frontalis muscle that I was talking about earlier that lifts your brows. We don't want that paralyzed because we want to be able to keep your brows elevated, so to maintain the result of the surgery. The nerve itself is preserved through the whole case, and the risk of nerve injury is less than 0.1%. So there's a very low chance of you ever having to deal with this problem. We can have temporary nerve injury where that's from the injection of the local anesthetic at the time of the surgery. So after surgery for a day or two, it may be where you can't lift your brows because everything's swollen and numb. So that can happen. But usually it's temporary, short-lived, and I've never had a brow lift where there was permanent injury or there was prolonged past a few days. Right, next thing here is damage to deeper structures. What other structures can be injured in and around this area? We are working around your eyes, so with a brow lift surgery and endoscopic technique, we lift the lining of the bone off the bone itself and release those attachments. When we do so, we are moving and tissues around the eye itself, so you can have some bruising around those areas. The other thing that you need to know is that in this portion of the outside the face, there's a lot of lymphatic vessels, and all our lymph nodes drain on the side of the face down into the neck and back into the subclavian vein towards your heart. And so in that area, when we're doing the procedure, it can disrupt the lymphatics, which means you might have more swelling on the outsides that takes several weeks to months before it finally completely goes away. So that's having to do with your lymphatics. Asymmetry. The two sides of your face are not the same. And people, if you do take a portion of your face and you copy it over, if you take a split and copy it over, you will see that your two sides are not the same in how they appear. And asymmetry is normal, and it actually is natural. So if you see somebody who has a very symmetric face, because they've done studies where they're showing this, then it actually is visible to most people that they say that looks unnatural. So asymmetry is normal, and our brows may be at different heights, our eyes may be at different heights. The surgery itself will not address any underlying asymmetry that you currently have. Those asymmetries will still be there. If you do have a distinct difference in your brow height, we may decide to do some tweaking during the surgery to lift more on one side than the other. Again, We do our best. I do my best to get the two brows as symmetric as possible, but I can never guarantee that they will come out to be symmetric, as God has given you that asymmetry. All right? Delayed healing. You can be slow to heal after this surgery. Most of my patients take about 1 to 2 weeks to heal completely from the surgery itself. They're presentable by that time period. Some people can take longer, and you just have to be patient with the process because everybody doesn't fall right in the middle. There's outliers, and you may be an outlier. Last thing that's specific to Browlift surgery is seroma. Seroma is a fluid collection under the flap of skin that can occur, and is usually, if it does occur, we can drain that and eliminate it. It's not common for Browlift surgery, and it's more common with facelift surgery if you're planning on having the Browlift and the facelift together, though that's more common for the facelift surgery. All right. Now we move on to general risks of surgery that are true for any type of surgery, and the first thing is healing. We talked about delayed healing already, so I'm going to skip this part. The next on your sheet is going to be talking about bleeding. Again, I've already highlighted about bleeding and the chance of a hematoma, so I'm going to skip this part. Next is infection. Earlier I already discussed infection, so we'll skip to the next on this list, which is scarring. Scarring can happen with any type of surgery, and when we make a cut, it leaves a potential visible scar. Those can occur, and if you do have an infection after surgery, it can make the scars more visible and noticeable until they completely heal. So just know that be patient. If something happens after surgery that slows down the healing process, you've got to give it a little more time for everything to heal. Next is ileus. That means that your bowels may be slow, and that can occur from taking narcotics or any of the medications that you're taking around the time of surgery. So again, if you need to take a stool softener to help you go, please do so, because you don't want to bear down after this surgery and increase your blood pressure for a risk of a hematoma. Firmness. Any area where the incisions have been made, the scar itself will feel firm to the touch, so in the scalp or right above the brows, when you feel them, the scars will feel thick and firm and maybe even numb before it returns back to its, like the rest of the skin surrounding it, and that will soften up with time. As the skin heals, you'll also have the areas of numbness become more sensitive. As the nerves start to wake up, you will feel more sensation. You might feel tingling, you might feel nerve shocks that are happening, you might feel itching, and it's normal to have some itching in your scalp. All of this is normal to occur. You'll have to be careful when you use a blow dryer, because as the nerves wake up too, you might have some sensitivities to hot or cold. Major wound separation. This is uncommon with Browlift surgery. There's not a lot of tension that's done on the incision itself, so there shouldn't be a potential for the incision to open up, but it can, and if it does, it's easily treated. Putting a little bit of antibiotic ointment usually helps it to heal and then close up completely. Sutures. There are sutures that we place that are dissolvable, and that's the ones that we place in the outside of the brow in this temporal area. Those sutures are deep, and they can create that little dimpling that I was talking about earlier. Those sutures will dissolve, and it takes about 4 to 6 weeks to go away. You may have an irritation to that suture, and if so, sometimes we have to inject a little steroid to address that irritation. But I have never had to go back in to remove sutures per se. Damage to deeper structures. I already discussed what other things could be damaged during this process. Fat necrosis. There's potential anytime we lift the skin, that the skin itself, the fat right under the skin, can die just from the lift of that procedure. It's uncommon because most of the procedures that I do for Browlift are deep in order to address the underlying tissue. So I rarely have this problem occur. Then surgical anesthesia, I talked about earlier already, about the risks of general anesthesia and local anesthesia. Shock. Your body can go into shock from just the trauma of the procedure itself. It's uncommon. The anesthesiologist is helping to maintain everything and your health during the case itself, so that you're stable, blood pressure and everything is stable. So again, this is uncommon. And then the last thing on the list for brow lift surgery is pain. Any surgery can create some pain. We're doing something that's traumatic to your body. So during the healing process, the normal healing process is to have some degree of pain. Again, the pain is limited. It's usually mostly in the first few days after surgery, and most of my patients need to take a narcotic perhaps the first or second day after surgery, and then that's it. So after the second day, it's mostly swelling that you're dealing with and pressure. Now, for some other ones that are more rare, cardiac and pulmonary complications are rare to happen. We've already, at this point, should have cleared you for your surgery by having you see your primary care doctor or go to urgent care to get the medical clearance. So if there's anything that's concerning, we would not proceed with the surgery. And so the risk of cardiac or pulmonary complications should be really relatively low, very low, actually. And then a venous clot is a potential. That means a deep vein thrombosis or a clot in the venous system. That can occur if you're not moving right after surgery. We want you to be walking as soon as you can. Of course, the first day, take it easy. But as you get more energy and momentum, we want you to be moving around the house. We don't need you to be going right back to your workout routine, but it is helpful for you to get up on a regular basis out of the chair to move around the house. The other thing that might be helpful to avoid a clot is to get compression stockings if you do have any concern, because there may be a family history, or you may be on medications that increase the chance of developing a clot. Allergic reactions. You could have an allergic reaction to any material that we use, like a tape, a suture material, glues, blood products, topical preparations. These are uncommon, but they can happen. We wouldn't know until, of course, they showed up. And then a drug reaction. You could have the development of hives or an allergic response to a medication we give you that you're not familiar with. And then, of course, the thing that we would do is stop the medication. Surgical wetting solutions. So I do use dilute local anesthetic, but it's not at a volume to be toxic to your heart. For those patients who get liposuction in combination with any other larger procedures, then when we're doing multiple procedures, we have to space out the local anesthetic because it could be toxic to the heart. But in the case of brow lift surgery itself, there is very, very, very low chance of this happening. Fat air embolism. This means fat could embolize or break apart and get into the blood system. This occurs with liposuction. The risk with this procedure is absolutely zero there. But what else can happen is an air embolism, and that can occur if there's liposuction or if there's a big pressure of air that goes right into a vein, and that can embolize to the brain itself. Again, uncommon. We're not doing anything that would be doing that. Persistent swelling or lymphedema, that can happen in the outside, this area where I said, the temple area, where the lymphatics drain. And then last thing here is unsatisfactory result. So good results are expected after this surgery, but you may be unhappy as the recovery process is occurring, that the brows are either too high or not at the right position. You have to give it time. So your body is still healing, so you have to be patient during the recovery process to allow the brows to settle. And it can take around 2 to 4 months to reach the final result with the position of where the brows will eventually settle. So be patient with that. And then additional advisories we want to let you know about. So there are medications and herbs that you're going to need to stop before your surgery. You should have received a list that lists out all the blood thinners that are possible, that if you are taking any of these vitamins, supplements, or medications, you'll want to let us know and stop it 2 weeks before your surgery. Sun exposure, direct or tanning salon. If you do get any sun exposure, you want to limit it during this time heading into surgery, because the sun exposure can lead to some injury to the skin itself, the surface, and when we make the cut, that can lead to poor healing in that area. Of course, after the surgery, is a given. You also don't want to be in the sun to avoid damage to the incision sites. Travel plans. We don't want you traveling anywhere far for the 10 to 14 days after surgery, because that will increase your risk of developing a clot. As we said, we want you to be moving around, and any travel plans where you have to be sitting in, let's say, a plane, and you're sitting in the seat for long, extended periods of time, your body is still in its healing mode, and it's going to have a higher chance of creating a clot if you're not moving. Long-term results. The results of this surgery should last you a very long time. However, how long it lasts all depends also on how you age. So a majority of my patients can get anywhere from 5 to 10 years of benefit from this, maybe even longer. But where you fall in that spectrum, average is 10, you may be at 5 or you may be at 15. And again, I cannot guarantee the length of that. It will all depend on how you age. The other thing that can affect your healing process and how long this result happens is other things such as sun exposure, exercise where you're having a huge weight loss after surgery. It can decrease the elasticity of the tissues, so those are all important, as well as pregnancy and menopause. Hormone changes can affect the skin and the tissues themselves. So all that being said, that will determine the longevity of the result. Interference with sentinel lymph node mapping. This is uncommon to even be concerned about, is most common with breast procedures, but if you've had some melanoma on the skin in the face, they do have to do sentinel lymph node mapping to map where the lymph nodes are, so you can have some disruption of those procedures, and you'll want to know to let your oncologist or anybody who's doing that procedure that you've had previous surgery in the area. Body piercing, so any jewelry that you have, you'll want to take off before your surgery, because that will conduct the metal will conduct the electrical current that we may need to use electrocautery to stop any bleeding during the surgery. You'll want to remove any nail polish on your nails, because we do use a pulse oximeter to judge how much oxygen supply is currently going through your system and in the veins. Future pregnancy and breastfeeding. Before surgery, of course, we want to know that if you are pregnant or you're breastfeeding, because the surgery itself, the anesthetic, and any of the things that we're doing could have an effect on your unborn baby or with the breast milk. So please let us know that. Female patient information. It's important that you let us know if you're using an estrogen replacement, birth control pills, or anything that could increase the hormone levels, because that can also increase your risk of developing clot in the deep venous system. Intimate relations after surgery. Sex is exercise. So I will say this again, that 2 weeks after surgery is when you can start resuming exercise. So for the first 2 weeks, avoid anything that would increase your blood pressure. Mental health disorders and elective surgery. It's important that all my patients seeking to undergo this surgery have appropriate expectations. You have to have realistic expectations going to the surgery. We are not going to make you look like a certain person. We're going to make you look like you, just better. And that's our goal. That's our hope. We're not planning to look for perfection. Additional surgery may be necessary. So in some instances, there may be minor things that we might have to address after surgery. It could be, let's say, the scar itself, you don't like how the scarring developed. Or it might be that as things healed, they didn't heal appropriately. These are things that we can address after surgery. The chance of needing additional procedures to address that is rare, but we do put that in because we cannot predict how you will heal. And then patient compliance is huge for this procedure. Please follow the instructions that we've given you and watch the video on the post-operative instructions, because that will help make this result successful for you. So you've really put in the time and the money and the downtime for this procedure, so you want to get a great result. Smoking, secondhand exposure, or nicotine products, you'll see on the consent that it just asks you if you're currently a smoker or you've been using any nicotine products, because that can have an effect on your healing process. So just review it and check it when you come in for your review of the consent. We'll have you review that. Sleep apnea or CPAP, if you do have any history of sleep apnea, we also want to know about that, because that can also have an effect on your healing after surgery. You may be a slower healer. DVT risk, so we're going to ask you what conditions that you might have, such as your past history of blood clots, a family history of blood clots. Those are important to know before your surgery, to know what your risk level is. So you'll fill that out when you come in as well on the consent form. And then the things that we'll do to help minimize the chance of getting a developing clot is for you to walk as soon as you can after surgery and use compression stockings after the surgery. And then, as I mentioned earlier about the disclaimer, do know that this consent is meant to cover as much as possible, but may not cover everything. And there is a communication consent at the end of the consent form. That is to allow us to know what's the best way to contact you. Typically, the day after or the day of surgery in the evening, I follow up with you, and we may need to follow up with you for the subsequent days. So please give us the phone number and best way to contact or communicate with you. And that is it for this consent. I hope that this consent has provided you with as much information heading into surgery. Please write your questions down if you have any after I've gone through after you've gone through this whole video, and we'd be happy to answer questions at your preoperative appointment. Thank you for listening.